Should you need all of your teeth replaced by some prosthesis, those false teeth could be either on a normal denture, which you take in and out. Now, the advantage of the denture is that it's probably around about $1,500 to $2,000 for a denture. Its disadvantage is that in the bottom jaw, the bone tends to shrink quite quickly, so that a lot of people have trouble eating with a bottom denture, that it's clacking around, they fall out when they're laughing, they can't eat apples. So a lot of people might be socially embarrassed as well about those same issues. So should you have those problems, or should you wish something alternative, 2 implants in the bottom jaw is a highly predictable procedure for retaining a denture. So if your concern is that your teeth are moving around everywhere and are loose, then 2 implants can allow quite a firm grip there of the implant, so you won't need any denture glue or like to hold onto that one. In contrast, if your concern is that every time you bite on foods that your gums are sore, that you've got so much recession and shrinkage of the bone and gum that there's no support given to the gums, you may actually need something more in the form of either a fully fixed prosthesis. So this is 4 implants here, permanently retaining an acrylic bridge. And depending on how heavy your bite is and a number of other factors, including your lip profile and how much support these teeth give to the cosmetics of the display of your top lip. So if you achieve a lot of plumpness of your top lip with teeth in, and when you take your dentures out your lip collapses in, then you may actually need, although some people want to have a permanently fixed prosthesis, they may need this acrylic flange, this pink component, to keep that lip plumped up. And again, this is a removable prosthesis, just having a bit of trouble there. So in the top jaw, sometimes you might decide for different reasons to have 4 implants to retain that denture. Or you may permanently fix it there on 4 implants as well. Again, the number of implants is really dependent on your situation, whether it's 4 or 6 in the top jaw. It does depend on how many teeth you want placed back there and what's on the lower arch. If you've got natural teeth down here, it's going to put more load on these top teeth. So you're probably going to more head towards 6 implants in the top jaw. If in contrast you have a denture down the bottom that's chewing on this, they're not going to give as much force against this appliance up the top, so we may decide that 4 implants is sufficient to hold that sort of prosthesis. Other people that are really abhorrent about the whole idea of ever socially having to remove teeth really would go for a fixed prosthesis, and that may be in the form of or implants. This person having 6 implants to hold that permanently in place. So a number of factors are considered when you're planning the full arch to be replaced by teeth that are held onto implants. Primarily, what are your concerns that we're trying to address, and how much benefit is this acrylic flange giving to your cosmetic profile with the plumpness of the lip. So we really need a consultation in combination with CAT scans to determine have you got enough bone in the right areas.